extremely good experience here in working with the government, with the district council, in promoting this issue of access of healthcare to older people to come for screening. We could see whether we could then take it to the communities and have the screening sessions in 1 or 2 centers. Those logistics can be worked out, but at the moment the essential thing is whether we could access the older people with the eye care and the eye treatment. They go to the hospital and present that card, then you don't have to worry whether they are able or not, because they've got the identity card. So this access to healthcare works in conjunction with exemptions, medical exemption and the identity card. And that is what CHAWAMA has been promoting, to make sure that all the people who are eligible for healthcare, free healthcare, must have some form of identification. And that would prevent the problem of deciding whether somebody is able or not. So that's the first issue. And the second issue is whether we can create eye care for older people, because as people get older and lose control of their eyes, their life already in poverty becomes even more difficult. So if we are able to make sure that they retain their sight for as long as possible, at least for that matter, they will be more enabled and more empowered to do things on their own. So that is what we are exploring, and now CHAWAMA will be able to tell you how that program in Arumeru has been promoted. How have we ensured that all the people who are eligible have access to free healthcare? When they go to the hospital, what do they have to do to prove that they are over 60 and under government policy that eligible for free healthcare?
Actually, that program is done in Arusha municipality and the Arumeru district. And what they are now doing is that they are preparing the ID for the older people so that they get free access to health care. Problem is that when people do come to this hospital is referral in that case. When they are referred to this hospital, they don't get that free medicine, free care, as they do get in the district council hospitals. In that case, the former regional medical officer had said that all district councils all older people should be treated freely in the hospitals of the district councils. And not only Monduli, it started with Monduli, then Arumeru, and thereafter Arusha Municipal Council. We don't know much of the Karatu and Ngorongoro because we have not reached those districts. But for those districts we have reached, all older people are being treated without payments. Actually, what they do buy is the exercise book for records. And the exercise book goes back with him so that when he goes to another dispensary, he will produce his records from the exercise book. Therefore, we have a problem, sure, from this hospital that when people are coming here, they are paying for that. Besides that, some people are coming straight, then they are going to pay for bypass fees. But those who are being referred from the district hospitals are still paying in this hospital.
I think this is a big challenge that all district councils. What is happening is that the government policy has been made and it is to be implemented by district councils. Now HelpAge International, together with his partners, are promoting this issue with the district council. We are working, first of all, to make them aware of the policy and what the implication of that policy might be and what it might involve. Now, where we come across constraints like you, sir, are mentioning, then we bring back that constraint when we have, when we present the results of our project. For example, CHAWAMA's project in Arusha and Arumeru. We will then say, look, the district councils are facing constraints. Like the older people in these two districts have told us that we can get to see the doctor, but when it comes to buying, to getting the medicine from the pharmacy, what the doctor has written is not available. We can buy it to the attention of the medical officer, saying that look, while the access is there, they're not getting the medicines. So what do you do? Is it because the funds are not there? Or is it because there is pilferage happening? Is it because there is leakage in the system, or what? So these discussions are ongoing. Because we are saying that if the government has made this, given this entitlement, then we have to work to make sure that the older people get access. They've got no other money. So where do we move from here? Okay, so while it comes back, what we want to do, go back on this eye care program. Let us discuss what you said. For example, if you were to set up an eye unit here, or you already have an eye unit here, and you were going to create the access for older people to come for treatment, eye drops, glasses, screening, cataracts, all those. You and I can go to Zanzibar, and then we can look at the program there. You can, and the experts will, there are 3 people there who are running this program, who can explain the things to you, who can explain the financial implication, cost, and how much is it possible to raise from the members. Yeah, what does CHAWAMA say? Mr. Hussain?
The problem with the new medical research is experience. He needs education. He needs to be informed of what is being happening. And of course, it was started with the reform arrangement this year.
The training, eye care training.
Yes, he needs, he himself needs training.
What?
Already
Yeah.
now. He needs
Sensitization.
Yes,
Yeah.
exactly.
Maybe I want to ask you about the Zanzibar eye program. There is these people, old people, maybe with cataract, who need surgery, and they are not able to pay.
They're not charged.
Yeah. So where did these people get the funds so that they can get the intraocular lens or what?
We provide a small grant to the Zanzibar program. That's what I'm saying. So eye department, the salaries and the eye department expenditure is covered by the ministry.
Yeah.
We pay a small grant and to look at the program. Now you coming from your expertise, you're talking one expert talking to another expert, they can give you the how far have they gone, what are the constraints they've made, what is possible to be covered, etc. And then we can, this is where when you're talking about development, this is what happens. Because your considerable experience would tell you there's a problem. How can we do this?
Yes.
These guys will tell you it's possible if we do this. That's when we can start and that's why the experiences that they have gained in Arusha and Arumeru, we want to make sure that that experience is available to other districts. Let me tell you, sir, that we work, we are a small organization, but we work, our work has expanded because of partners like CHAWAMA.